This is PediaCast.
Welcome to PediaCast, a pediatric podcast for parents. And now, direct from the campus of Nationwide Children's, here is your host, Dr. Mike.
Hello, everyone, and welcome once again to PediaCast. It is a pediatric podcast for moms and dads. This is Dr. Mike coming to you from the campus of Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 548 for November 29th, 2023. We're calling this one Social Determinants of Health. I want to welcome all of you to the program. So we have an interesting and important topic for you this week as we explore the social determinants of health and how they impact child health, development, and welfare. And we will explore this topic with our Pediatrics in Plain Language panel, which means right here out of the gate, I should probably explain what we mean by social determinants of health in plain English. So here goes. As you know, lots of variables in our social life intersect and impact our health. Things like food and meals, housing, neighborhood safety, family income, quality of education. All of these things have the potential to disrupt a child or teenager's development, their health, and their wellness. So we're going to explore the ways in which these social determinants impact health, how they can result in disparities in health and wellness, disparities that really can last a lifetime. And most important, how can communities and neighborhoods and schools and families and medical homes rally around kids in an effort to keep them healthy and watch them grow and meet their full potential? So we're going to journey down that path as we consider the social determinants of health. Our usual plain language panel is with us today, Dr. Mary Ann Abrams and Dr. Alex Rakowsky, both with primary care pediatrics at Nationwide Children's Hospital. And we have a third member of our panel this week, Dr. Tyanna Snider. She is a pediatric psychologist at Nationwide Children's. Before we get to them, let's cover our usual reminders. Don't forget you can find PediaCast wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. If you like what you hear, please remember to subscribe to our show so you don't miss an episode. Also, please consider leaving a review wherever you listen to podcasts so that others who come along looking for evidence-based child health and parenting information will know what to expect. We're also on social media, and we love connecting with you there. You'll find us on Facebook, Instagram, Threads, and LinkedIn. Simply search for PediaCast. And then don't forget that handy contact link over at PediaCast.org if you would like to suggest a future topic for the program. Also want to remind you the information presented in PediaCast is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. If you have a concern about your child's health, be sure to call your healthcare provider. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at PediaCast.org. So let's take a quick break. We'll get our plain language panel settled into the studio, and then we will be back to talk about the social determinants of health. It's coming up right after this. Our Pediatrics in Plain Language panel is back in the house. You will recall that Dr. Mary Ann Abrams is an assistant professor of pediatrics at The Ohio State University College of Medicine and a pediatrician with primary care pediatrics at Nationwide Children's Hospital. Dr. Alex Rakowsky is an associate professor of pediatrics at Ohio State and a pediatrician with Olentangy primary care at Nationwide Children's. And we have a third member of our panel this week, Dr. Tyanna Snider. She is a pediatric psychologist and the clinical lead of the Integrated Primary Care Psychology Program and an associate professor of pediatrics at Ohio State. They are joining us as we explore the social determinants of health. But first, let's give our friends a warm PediaCast welcome. Thanks, all of you, for joining us today.
Thank you, Mike, and nice seeing everybody.
Yeah, thanks so much for having me.
Hi, everybody. Great to see you again, and welcome to Ty.
Yes. Welcome, Ty. And we're really excited to have you as we talk about the social determinants of health, because in pediatrics, really in medicine as a whole, it's not only our bodies that have diseases or injuries, but also really the environment that we live in really does matter in terms of our physical and emotional health. And so I think having a psychologist with us today is going to be fantastic. So again, welcome, Ty. Marianne, I want to start with you like we usually do and just talk about plain language. What exactly is that, if you could remind our listeners, and why is it important?
Thanks, Mike. It's always fun to try to think of a new way to describe how plain language aligns with what we're talking about on our podcasts. And just to reiterate, as I have before, plain language is straightforward, common, everyday words that people can understand, whether it's spoken or written, pretty much the first time they read it or hear it or see it, say on a sign even. And it's not meant to diminish, fancy words in terms of literature or things like that. But it's really a tool that we can use to make sure that important messages are conveyed to people clearly in a way they can understand. And we know that's very important in healthcare and all the things that impact health that we'll be talking about today. But it's also important in other facets of life. We talk about getting your car repaired or working with an attorney, a lawyer. We all struggle to not understand some of the words that are not unique to our personal lives or our work or our profession. So plain language is a really valuable tool, and it's important, and it takes a little bit of effort and skill to use it well.
Yeah, absolutely. And we are going to do our best to hold each other accountable. So that just means that if any of us on the panel here hears another accidentally using medical jargon, which it just comes out of our mouths so easily because it's the language that we learned when we were training and as we're practicing. But if we do notice that happening, we're going to be like, hey, up. What does that word mean? And of course, we try our best to use plain language in every episode of PediaCast, but in these particular episodes, we really try to focus on that. All right, well, let's move on. Oh, by the way, we do have all of our Pediatrics in Plain Language episodes packaged together as a playlist over at SoundCloud. So if you look up PediaCast and SoundCloud together in a Google search, you'll be able to find that. All right, Hi, what then do we mean by the phrase social determinants of health? And why are these things particularly important in pediatrics?
Mm-hmm. Well, social determinants of health, it really refers to those non-medical factors that impact health outcomes, kind of the drivers of health almost. And so these are just those conditions in the environments where we are born, where we live, where we work, where we play, where we learn, all of those factors, all of those conditions that then help influence one's health, one's quality of life, and their functioning. So, for example, this could be economic stability, having safe housing, transportation, access to nutritious foods and safe places for physical activity and green spaces, as well as racism and discrimination. All of those things are really encompassed under that term of social determinants of health. And they affect everyone. And they also contribute to those health disparities and some of those inequalities that we know exist. And even though we might think of these social determinants of health as non-medical, they're really the non-medical necessities. These really matter, and in some cases can really impact a child's development, health, and overall well-being, even more than that direct health care or medical care that we might be providing on those regular basis when we're working with kids and youth in well-child checks and physicals and in all the medical settings that we see kids. And we know that it's just important to address them as early as possible so that we can help promote health and well-being and really help everyone reach their full potential so that our patients and families have the chance to be as healthy as possible. They're really fundamental for improving health and helping to reduce those health disparities.
And not only do those social determinants of health, so, we're talking about things like everything that you interact with in your environment, including your housing, your education, the food on the table, how much money a family has, where they live, and whether that's a safe neighborhood or not. All of these things not only impact a child's life in the here and now, but Ty, they also impact a child's life as they grow into an adult. And we carry that with us. And so it's not only important now, but really during a child's entire life, right?
Yeah, absolutely. We know that it's important to really think about preventing these social determinants of health so that we can kind of get information about what is the community, what are the conditions in the environment that our patients and family live, so that we can help prevent these from becoming things that are then impacting or negatively impacting a patient or a family's health and their mental health and their just overall well-being. Because you're absolutely right. They don't just start in adulthood and end, they continue, or start in childhood and end, they continue on into adulthood a lot of the time.
Marianne, as you have practiced pediatrics and taken care of kids and families, how have you seen the social determinants of health impacting child development and their overall health?
So Ty did a beautiful job describing social determinants of health and kind of examples of what they are and that they affect everyone, right? But the unique piece about children is, as you put out in that question, development, because they are born into these circumstances. They spend the next 20 years developing and growing, and to develop and grow to their optimal best self requires nurturing and a healthy environment and caring and supports to optimize. That's a big word, not a good one for plain language pediatrics, but to grow up healthy and able to thrive. So when babies are born, their brains are waiting to have all kinds of external input to help mature and develop. And the areas that that get the most input tend to be the areas that blossom and grow, and areas that don't get as much input tend to not grow as much. And the most critical period of time is during those first 3 years, although that continues all the way up through young adulthood. So when children are impacted by social determinants of health, meaning they don't have a safe place to live, a warm house in the winter time, the stress related to not being safe or to having to move frequently or to not know where you're going to sleep that night, all those things that impacts the developing brain and the ability for parents to love and nurture their children, because they're worried about that too. It's been said that housing is almost like a vaccination. Having a safe, stable place to live lets you enroll in school. It gives you security. It lets you know where you're coming home at the end of the day. And all those things foster healthy child development and health overall. And then having access to a school, a quality school, being able to get to that school, to be able to get to that school safely, all of those things are part of those social determinants of health. And having access, we'll be talking about food insecurity and not having access to healthy, nutritious foods that are affordable affects the nutrition and the energy that we use to help our brains grow. So that can impact children's development. And it also contributes to chronic disease or diseases that start out in childhood and become more serious and can be serious problems as they get older. So we have problems with children being overweight and not active, and that leads to obesity and high blood pressure and all kinds of other health issues. And that also links up with not having safe spaces to go outside and play and to walk to school safely and to encounter their neighbors and their friends, to just go out and kick the ball around for a half an hour in the afternoon. It also affects parents for all those same reasons, but we also realize that living in those kinds of circumstances causes parents to be short on two other things that help them with parenting: time and extra and fun, money. So if parents are trying to work 2 jobs or trying to figure out which bill they can pay or how they're going to have childcare, that cuts into their ability to interact with their child, to read to them, to play games with them, to take them to activities, or even get them to what doesn't sound like an important appointment that we might ask them to see a specialist for or to see a therapy session. And then they may not have those extra funds to buy children's books and toys and to go to after school programs and activities that also foster development and healthy childhood, healthy habits that grow into lifelong healthy habits.
All right, Alex, I want to bring you into the conversation. How significant is the role of nutrition and food security in a child's health?
Yeah, so I think people tend to think of food insecurity as impacting the physical dimensions of a child. But I want to bring up like 3 other parts of development that actually food insecurity play a major role in. I'm going to reference a fairly recent document by the American Academy of Pediatrics and the Food Research and Action Center, or the FRAC. And it's called the Toolkit for Pediatricians to Address Food Insecurity. And they really have a lot of good data in there. And it's from about 2 years ago, where they talk about the recent data that kind of where food insecurity impacts children. And surprisingly, to some people, but I think to most of us who work in the field, the major impact really seems to be behavioral. And if you grow up in a situation where you have a lot of social determinants of health going against you, food insecurity kind of gets rid of your ability to believe, or it gets rid of what we call grit, to kind of sand away some of those adverse childhood experiences. So if you're always worried about the food on the table or the people really want to feed you, you do develop some behavioral issues. And there's been some studies that have looked at depression and anxiety being higher in food insecure children, regardless of other risk factors. Number 2, looking at behavior, especially in toddlers, there's some really nice studies that are ongoing that have looked at oppositional behavior, conduct disorder, not in the traditional, definition of them, but like toddler oppositional behaviors. And then ADHD seem to be higher in families where there is food insecurity, even when you compare those families to other families with the same exact risk factors. And then lastly, academics. And there's a study that's being done and it's ongoing to have data. They had initial preschool and kindergarten data. Now it's up to 3rd grade, where these children, again, if you balance out the groups for the same risk factors, except for food insecurity, the families who actually are food insecure, their children tend to do lower on academic testing in preschool, kindergarten, and it seems to continue up to 3rd grade because your kindergarten readiness kind of sets you up for a good elementary school. So it's kind of like behavioral, psychological, academic, then of course physical. And if you're not eating well, there are a lot of physical issues. You get obese potentially because there's lower quality foods, more constipation, more dental cavities, potentially more fatigue because you're eating lower quality food. So you're getting like a quick rush from your high sugar food and then kind of crashing, et cetera. So there is a lot of complications of food insecurity outside of just having the food part, being hungry.
Yeah, absolutely. What can we do to improve food security in our neighborhoods?
Now, this is a loaded question. You can do a whole hour on this, but I'm going to try to do this in less than an hour. The first is you got to know your clinic population. And so I actually give a lecture to all the interns about this. And step number 1 is to know who you work with. And there may be some clinics where you may be surprised by how much food insecurity is in the area. So the first thing is get to know who you're working with and their needs. Number 2 is to normalize it. We all, for our kids, they graduated, we took them to dinner. It's a birthday, we threw them a food party. When you went out on a date, you didn't go, jumping up and down on a trampoline, and maybe when you're like in 3rd grade. But, you took your loved one to dinner. So food for us means love. And a lot of parents are embarrassed if they cannot feed their child. So you have to normalize that. So you have to kind of let your parents know that, this is common. Make it part of your entire visit. Like have posters in the room, ask questions, but don't make it only food insecurity, and ask them in a way that the parents feel comfortable answering back. So that's number 2. And then number 3, once you know your patient and your family, there are ways to help. I'm going to start off with non-food related big money tickets. So earned income credit. So a lot of our families qualify for getting a tax refund at the end of the year if they earn a certain percent above the federal poverty level. And it's a lot of money left on the table. And we probably have thousands of families who could have gotten $1,000 or $2,000 or more per year at tax time if they knew that they qualify for this. And that's a huge amount of money that you can then roll into food down the road. Section 8 housing. where it's like guaranteed housing at a lower price compared to the rising prices nationwide. Even Columbus, like we've almost doubled our rent in the last 10 years. Number 3, non-food related is utility help, free air conditioning, free insulation. And there's a lot of programs in this area all around the country where you can actually get some free resources for that. And that lowers your monthly bills. So there are ways to help financially, non-food related, to kind of help with the food down the road. Then getting to food, 2 big buckets. The first is government related, SNAP, what used to be called food stamps, but it's the Supplemental Nutrition Assistance Program. A lot of people qualify for it and they're not aware of it. There is a recent study from the Ohio Department of Health that only 80% of people who qualified for SNAP actually went and got SNAP. So 20% of the people could have gotten at least some resources. And it's several $100s a month, up to $500 a month. WIC, Women, Infant, and Children Program, which again, not utilized completely here in Ohio. School programs, there are free breakfast and lunch for a fair number of kids in this state, which are not being utilized. And then those programs actually fund summer and weekends as well. So, work with your school to maybe have a summer program or a daycare after school program to kind of provide some food, which again is going to be covered by the same budget line as the school programs. And then the last is local. And then this is the local food insecurity. So food banks, get to know your local food banks, get to know your local churches, synagogues, mosques, recreation centers that give free meals and when. And then also home deliveries. So some churches will actually do home deliveries of food to people who have transportation issues. So a lot of resources, a lot to do. It's just a matter of getting to know them a little bit better.
Yeah, absolutely. And as individual families, we really can make a difference if we get involved in those programs, or if particular programs aren't available in your neighborhood or your community, really taking the lead and making it happen, because there really is money to do these things. You just got to figure out, who holds the purse strings in your particular area. So, Marianne, what challenges do children in low-income families face in accessing healthcare? For many of us, it's really easy. We pick up our phone and we call and make an appointment with our physician. But there are a lot of barriers that families can face just to get connected to the system, or to pay to be able to have your child seen. I mean, that would be just a terrible feeling if your child's sick or they're injured and you feel like it's going to be a financial hardship for your family. What are some of the barriers, and how can families overcome those?
That is a great question. And it's broad too. It's looking at high level factors all the way down to individual factors. But at the higher level, we're a little better than we used to be in terms of having health insurance to pay for children's health care. Until Medicaid was started many decades ago now. Medicaid is a major insurer for a lot of children, especially those who are impacted by social determinants of health. And then we have another federal insurance program called the Children's Health Insurance Program. So Medicaid is there for kids in lower income families, and CHIP that I just described helps pick up another group of children whose parents do have funds, but not enough to buy into the Affordable Care Act marketplace insurance packages. So we've made improvements over time in covering more children. That's a good thing, but we're still not there yet. We also these programs vary from state to state. They also have challenges related to eligibility changes. What's the income level? How often you have to recertify or reapply, and that can be a ton of work and really hard. Just think of what it's like when you're trying to get paperwork together for taxes or for anything like that. Imagine having to do something like that every month or 3 or 4 times a year. So there's the payment piece. And yes, there are free clinics, which are wonderful. And the federally qualified community health centers are also another resource. But as you can hear me talking about this, it's fragmented and it's not uniform. And we can barely figure it out. How do people who are not part of the health system figure it out? And how do people who are from another culture or don't speak English supposed to figure these things out? It's very challenging. And we're not talking about a luxury, we're talking about a human right to health and healthcare. So that's sort of the big system things. When we have clinic systems like the one at Nationwide Children's Hospital, our primary care network, I'm really so impressed by how hard we work to really address so many of these social determinants of health. And yes, you can say, well, we're a big system, but I think there are parts of that any clinic setting can consider. And just a few of those are like co-locating services, just like we have Ty on our call today. She and other psychologists, having them physically present in our clinics is such a wonderful thing. We can just reach out to them when a child has a behavioral health problem. We have many social workers who can help connect children and families to community resources. We partner with other community-based organizations and social service agencies. And then I think we touched on it and we'll talk about it a lot more. We use both the Reach Out and Read and the Imagination Library models where we talk about how important it is to share books and read with children. And we give those books out. So those are wonderful ways to help optimize that time when they are in our healthcare settings. And then we have those other things like in the fall, we help with voter registration on site. We have legal services available. We help with income tax and child tax credit when that was in place, preparation. So trying to make it a one-stop shop, I think, is really helpful for people. We have help with paying utilities or getting help with paying utilities. You'll hear us talk a little bit later about how we screen for other social determinants of health and offer resources when we identify an area where a family needs help. And we work really hard to have trained health interpreters available in person or by remote, and even for telehealth and telephone calls to the clinic or to schedule appointments to help make sure people really understand. And we are working to include much more emphasis on health literacy and teach back and use of plain language when we talk with families and children to really make sure they understand what we talk about and they can take that home and know what they know what they need to do to care for their children's health.
Ty, as you think about the mental health of kids and teenagers, how does the social determinants of health impact their mental health? What sort of things are you seeing in your practice?
Yeah, well, like Dr. Rakowsky just mentioned, some of those mental health and behavioral concerns that we might see just based on food insecurity alone. And oftentimes, these social determinants of health, these risk factors, aren't just happening in a vacuum. There's usually more than one that might be going on at the same time. And all of those impact not just physical health, but mental health too. And so we know that youth from lower SES backgrounds and youth who experience poverty are at greater risk for poor academic achievement, behavior concerns, developmental delays, depression, anxiety, ADHD. Having exposure to violence in the home or community can, of course, lead to PTSD in some cases. And even experiencing racism is also associated with the development of those mental health concerns like depression and anxiety. And you know that we're seeing a lot of mental health concerns in our youth these days. It's a national emergency. And so there's a lot of focus on making sure that we're working on recognizing, identifying some of these mental health concerns and some of these symptoms really earlier on so that we can help address them as quickly as possible, as soon as possible, and get children and families linked to those resources. We also know that we want to make sure that we're really addressing caregiver mental health too, especially even though we might be treating the patient, we might be treating the child. We're really treating the family, and untreated caregiver mental health is also associated with poor mental health outcomes in children as well. And like you mentioned, Mike, those often last into adulthood. And so they're not just kind of limited to childhood or to those youth years, but they then have long-term impact over the course of a child's life.
Yes, I thank you for mentioning the caregiver health as well, because I think we tend to forget that as pediatricians. And we can work all we want with the kids, but if the mom and the dad aren't doing well, then, they're the ones seeing the child all the time. So thank you for bringing that up, because I know I personally forget about that all the time.
How do you address that with the parents in clinic? Like, if, what sort of things would make you concerned that maybe a parent is not doing well? And then how do you approach that with them, knowing that you have the best interest of the child and the parent, and then, by way of both of them, the whole family unit?
Well, one of the things that we're doing at Nationwide Children's Hospital and our primary care centers is that we are doing maternal depression screens, and we're doing those consistently between those well-child checks, between the newborn visit all the way up until the 6-month visit. And so I think that's really important because we know maternal depression doesn't just impact the mom, but that impacts their infant too. And so we want to make sure that we're addressing postpartum depression and postpartum anxiety, and even just that stress and kind of that adjustment that we know is pretty typical and can happen after one has a child and has an infant, and it's a stressful period of time, even though it's exciting. We want to make sure that we're getting that information. And so screening can be one way to do that, especially with new parents, with new moms. I think also just asking, just having conversations, as we're in the room, maybe asking questions about the child and how things are going with them. Also making sure that we're turning to the parent or caregiver and saying, how are things going for you? This can be a really stressful period of time, or this could be a stressful age. How are you managing things? And is there anything that I might be able to do to kind of help you out? Or do you need any resources from me?
And just to add to that, so for example, let's say I have a child who has ADHD, very, very active, who's now getting medications and counseling. So the focus has always been on the child. But there is a national program called, for example, Triple P, or Positive Parenting Program, where they can help mom or dad learn tricks to do at home to kind of, instead of having an oppositional sort of relationship at home, how to be more positive towards your child who's getting help for their ADHD. So we've been doing a lot more of that, like getting the whole family enrolled into some sort of counseling, more in educational, but it's made a big difference.
Yeah, absolutely. Alex, another thing that really can impact neighborhoods and the climate in which a child grows up is their education. How do educational opportunities impact health outcomes in kids and teens?
Yeah, it kind of goes back to the same data that we're now seeing for food insecurity and what Ty mentioned about the impact on infants from having a mom who's struggling with depression. Kids get wired pretty quickly. You can change the wiring, but a lot of the hard data, like the sort of mainframe, is being set in the first 4 or 5 years of life. So if you struggle going into kindergarten, there's a lot of studies showing that you may struggle down the road, or you have a higher chance of struggling down the road. So I think it's important to make sure that not just at a school impact level, but get literacy development as part of a major initiative in your clinics. If you can get the kids to read and love to read, and the parents engage with that, they'll make them more kindergarten ready. So regardless of the school they're going to go to for kindergarten, they already have a certain built-in love for reading and curiosity, which is going to carry them a lot further into school. So as far as educational opportunities, if you don't do well in kindergarten and you don't do well in elementary school, you then in your head become that weak kid educationally. In other words, this is not for me. And then you struggle. And then it becomes more of a, I don't want to go to school because, if we had a job and we all didn't like to go, or you're like, I go to the ER or urgent care and I make a mistake every time, I don't want to go there next time. So that's sort of the mindset that they get. And it's hard for these kids to then go to high school, try to finish high school, let alone go to Voltech or colleges down the road.
So how can families sort of break out of that educational, low education cycles when a particular community, they have schools that, that kids have to attend. They don't really have a lot of choice. So how can we improve that for families?
I think there's a lot of things that can be done in the family to help improve that, but also from an advocacy level, from kind of a state and federal level, in terms of us as providers being able to go advocate maybe on behalf of some of these families and the communities that we serve, that can be a really important thing. Even in thinking about investment in school-based programs that are addressing, early childhood, but also the mental health, and kind of integrating mental health resources and interventions and services within the school can be really important. And then for families at home, for caregivers at home, I think having those conversations with their child, kind of making sure that we're reading books to our kids, even from that really, really young age. And that's one of the reasons why, it can be at times challenging to have books in the home, especially if there's lots of other factors that are kind of impacting that, or we're struggling financially to have food on the table. That might be something that we're not purchasing. And that's one of the reasons that at Nationwide we have Reach Out and Read. We have that program where we're giving books to patients and families during their wild child checks to have them have something to go home and kind of make sure that they're interacting, that they're reading, that they're doing with their child to help promote some of those early educational activities.
If I can add like a couple things here. So in addition to Reach Out and Read, we also have the Imagination Library, which is the Dolly Parton program. You get a free book in the mail for the first 5 years every month. So you can have a library of close to 60 books for your child before it's all done. Just to kind of add on to what Ty mentioned, every child, I think, has their own talent set. And we tend to think of talents, how do you do in school? But that may be something you bring up at the well child visits. What is your child good at? Is it reading? Is it drawing? Is it working with their hands? And then kind of like augmenting that down the road. We have 7 kids. We have one who loves working with his hands, ended up being a house flipper and a realtor. And the traditional college path, I mean, he did it because my wife was like, you got to get this done. But it was one of those things where he just had a different talent set than, let's say, his brothers. And a lot of times it's just the parents being sort of empowered to empower their kids to follow a talent that they have. It could be electrician. It could be auto mechanics. It could be working something else, which is not your traditional, I got to get straight A's to go to the best college possible. And then the third thing is the community plays a big role. So I grew up in the hilltop version of Philadelphia, which was not the best neighborhood, but we had a local mom and pop supermarket, which was the supermarket. And every month, the local high schools, there was a big Catholic high school and a big public high school, had their student of the month or other achievements, be it like, sports or arts or, you were in some big play. And at the checkouts, they would have like a poster and then congratulating the students. I remember just seeing my face there like once or twice. And it made a big deal because for a month, like the whole neighborhood celebrated the fact that, John got the lead role at some musical downtown Philadelphia. And, I think the community can sometimes pick itself up also by celebrating the kids that they have in the neighborhood. And like the Hilltop Shalom Zone here in Columbus does a great job of that at the local library. So just another thing that you can do to help like promote education in all its aspects.
Marianne, what role does a family and a community support play in all of this? As we're thinking about education and we're thinking about food security and housing, what role does that support by those around us make a difference in shaping child health?
Yeah, I'd like to tag on to what Alex just said and just come back to, what is that overall definition of social determinants of health and where does the rubber meet the road? It's the places where children live, play, learn, where their families work and interact. So Alex gave a great example of a community that celebrated kids who had achieved a milestone or something special in their lives. And I think the important thing about that and all of what we try to do and the way we should think about all this is looking at the assets of a community, not just their deficits or our judged deficits, because communities are made up of people who are strong and resilient and creative and I'll say resilient again because they're overcoming so many challenges. So how do communities do that and build on that? Thinking about sort of what Alex described sort of was like at the individual level, and then thinking about ways to open doors for and empower communities to create safe places for children to play outside or safe ways to walk to school, the little walking school bus ideas, supporting group neighborhood watch type things. So again, so kids can get outside and play, support childcare, things like that to make it a safe community where people can interact, thrive, and connect. And so much of that seems to link up with physical activity and walking and having those opportunities to encounter your neighbors as neighbors. And then supporting those, recognizing that all these social determinants of health are so important, investing in communities. And Nationwide Children's Hospital does a lot of that with our Healthy Neighborhoods, Healthy Families work, where we partner with and work with the communities and address housing, food insecurity, access to healthy, nutritious foods, job training, and all those things that help build community and help address social determinants of health.
Yeah, absolutely. As we think community, a few years ago, our community was just, the people who lived in our neighborhood. And today, with the social media and technology really becoming a major part of everyone's lives, regardless of income or means, really there's a whole nother community that we have to think about. So Ty, as we do think about technology and social media, what do parents need to know about their impact on social and emotional health?
This could definitely be a separate hour-long podcast.
Yes, it could.
But
Tomorrow. Yeah.
But what we do know is that we actually still have a lot of work to do to better understand the mental health risk associated with social media. It's still relatively new, but like any activity, social media has its risk as well as it has its benefits, you might be surprised to know. And we also know that youth are using it, right? It's almost universal. Most youth are spending at least 3 hours a day on social media. And what we do know is that the risk of poor mental health, including experiencing symptoms of depression and anxiety, really doubles. And that it really doubles when they're spending as much as 3 hours on social media. And so with most youth spending 3.5 hours, that risk is pretty concerning. We want to make sure that we're paying attention to that. Again, we know social media use can increase anxiety, depression. It can negatively influence brain development and really just increase the risk for exposure to some of that harmful content. So hurtful language, maybe bullying, maybe violence, again, in the community, but also globally. And so we want to just make sure that our youth are consuming social media in a more responsible way. And we might need to be setting some more boundaries around social media use, really talking about social media, having those conversations, teaching our youth about responsible online behaviors, as well as, like I said, kind of just setting those boundaries for everyone in the house, not just the youth, adults included. We want to make sure that we're modeling the behaviors that we want to see our children doing. And so that might mean that we're protecting sleep time, that we're shutting phones down an hour or 30 minutes before bedtime, that we're protecting meal times and making a family rule that there's no phones or no tablets at the dinner table or at the breakfast table, as well as using those parental controls that you have access to and talking with your kids about those parental controls and why you're using them. One of the things I talk about a lot with families is setting this or developing a family social media plan so that we just have everything kind of laid out. This is what we're going to do. Everyone's going to do it. And we're going to be checking in to see how everyone is doing with this. And then if you're using social media, which inevitably is going to happen, just talking about it, engaging about it together so that it can be kind of an interaction instead of just solo behaviors, right? So that we're not just both scrolling on our phones during the course of the evening, but kind of engaging with it together. It's okay to watch YouTube videos, but maybe let's watch those YouTube videos together as a family.
Yeah. Great advice. Alex, in terms of public health initiatives to support the social determinants of health, how can lawmakers get involved and sort of guide policies and programs within a particular community?
Another hour-long session for people who are a lot smarter at this than I am. But I think there's a couple observations. The first is we need to have a better handle of what works and what doesn't. We know that food security resources help. So WIC, SNAP, et cetera, seem to help. We know that preschool Head Start seems to help. There are some school initiatives that seem to help children kind of advance further. So I think the key is, one, know the data. So when you talk to a lawmaker, you can say, if I have a food insecure pocket in my city or in my clinic, is there a way for me to help that group? Because that may impact their kindergarten grades and third grade, for example, data that we have so far. So I think knowing what's out there kind of makes a difference when you talk to your legislator. Just throwing money out without some kind of focus, I think, is the wrong approach. So you really have to know where to kind of put that money, because money always seems to be tight. And then the second is what is needed. I think different communities need different things. So I work at the Olentangy Clinic, which is heavy with immigrant families. So they tend to have food. They tend to have housing. A lot of them brought each other over from overseas. But transportation is a major issue, as is educational resources for the parents and secure jobs for the parents. So our focus, for example, in our clinic and our social worker tends to really focus on that. Ty's clinic is right down the street from us, and you have a very, very heavy group of immigrants from a different part of the world where, it's a very different set of needs. And then our downtown clinic has a lot of housing issues. So you almost have to know, I have X limited time and X limited resources, both hour-wise and money-wise in clinic, that we can kind of support our families the best we can. So I think knowing the neighborhood also makes a big difference when you talk to local legislatures.
Yeah, absolutely. How do folks find out who their local legislators are, Alex?
I mean, there's both the Ohio government has the local list. I'm going to drill down even more. And we live in Licking County, which is more rural. So we have our state representatives. We also have our local representatives. And for example, I've been active with the Hilltop Shalom Zone for a while. That's not a state representative doing all that work. It's essentially a local council person from the Columbus City Council and a couple local representatives in that area that put that together with the local community members. So even knowing the people in your community that have some budgetary response or can help get budgetary responses is important. And then there's a list of who is your representative at the state level and at the federal level. But honestly, as a primary care pediatrician, when I look at my families, I don't think at national level a whole lot for individual problems. We need money to help out with the resources, let's say Tide provides. But, I need to know who in the community I can send to, who's supporting the local behavioral health groups, who's supporting the local food banks. And that's not at Congress. That's really more at the local level.
Yeah, absolutely.
I'd like to just add one thing to that. Everything Alex said is 100% right on. But one of the other ways that every single person 18 and older can get involved is to vote, to register to vote, pay attention to the details about the last day to register, the way to get an absentee ballot if you can't show up in person, and to learn about the issues and the candidates so that when you vote, you can advocate for what you believe to be important. And there are good resources for that, too. There's the Secretary of State's website. There is the League of Women Voters and other sources for good information. And not voting is an act of not supporting and being involved in advocating.
Yeah, absolutely. Ty, so what are some of the ways, and you've actually already answered some of this, but I know with an institution as big as ours, there's so many projects and programs going on. So what are some of the ways that Nationwide Children's is working to improve social determinants of health in the children and family that we serve?
I know we've talked a lot about some of the negative outcomes and risk associated with SDOH or social determinants of health, but there is good news. There are ways of preventing these outcomes by addressing these social determinants of health and by really promoting resiliency, which is so important when we're thinking about how can we address these social determinants of health and how can we maybe mitigate these negative outcomes that can happen. And so I think one important thing to do is to just ask patients and families about their strengths, kind of get that information about what are some of the protective factors that our families are coming into the clinics with and bringing to these appointments and bringing to their home and to their family. And really that just needs to be a partnership, a conversation. But we're also doing a lot of things institutionally, like you mentioned. NCH is already doing social determinant of health screening. We're doing maternal depression screenings universally in our clinics. We have care coordination services. We have medical legal support available to our patients and families. And we're actively helping to solve some of those other, maybe more structural or logistical barriers in terms of like transportation barriers, linking families with community resources such as food pantries, or access to secure housing. And we also have a really strong level of behavioral health integration and social work integration. And I think that's so important when we're thinking about some of the things that we can do to really address these social determinants of health and hopefully prevent some of these negative outcomes from occurring. But there's also things that you can do on your own individually, right? We need to make sure that we're getting out of the hospital. We need to make sure that we're getting out of the clinic and into those communities. We need to work to learn a little bit more about the communities and understand the communities that we might be serving or that we might be living in, and really work to engage with those stakeholders, build those relationships. And by stakeholders, I don't just mean the leaders in the communities, but the citizens, the residents of those communities, right? They're stakeholders in that community too. And so we want to make sure that we're hoping to get out into the community, build those relationships, and really take things out of the clinic or hospital setting.
And we have so many programs at Nationwide Children's, including Healthy Neighborhoods, Healthy Families. Tell us a little bit about that.
Yeah, so we do. We have Healthy Neighborhoods, Healthy Families. And that's one of our programs at Nationwide that's really focused on getting out of the hospital setting and getting out of the clinic and into those neighborhoods so that we're helping to, improve the neighborhood and the communities where a lot of our patients and families might be living. And I can speak directly to, I know one of our psychologists on our team, who's now the associate clinical director for Honor Sleeves, kind of helps support that Healthy Neighborhoods, Healthy Families program. And so she's running some parenting programs similar to the one Alex mentioned a little bit ago in the community at a community center for our Linden families to kind of help address some of those parenting behaviors and maybe give families tips and supports for how to manage some of those challenging behaviors that kids have, right? They all have challenging behaviors, and we could probably all use that support. And so that's one thing that Healthy Neighborhoods, Healthy Families is helping us out with. And I know they do a lot of other things in terms of even building houses and remodeling houses and making sure that patients and families have access to safe houses and green space and things like that. And Alex and Marianne might have even more to add.
Yeah, I think a lot of the initiatives really focus now on community centers. So like building the physical houses makes a huge difference, but the Healthy Neighborhoods, Healthy Families has kind of endeavored more into let's integrate things into community centers, into local schools. I think it's called the PACS program, if I remember right, where they're actually getting some work being done at the local schools and rec centers. And I mean, that's where parents are and that's where kids are. And it goes back to getting them off the screen. If you actually have a rec center that's functional and has fun things to do for the kids, they'll want to go there instead of sitting on YouTube for 4 hours. And while the kids are there, then you have the parents there also. And like our local library actually has our kids are a lot older, but when they were younger, they were like kids programs. And then the parents had like little meetings where we just sit and talk about what have you. And it was just nice because we all go through the same thing as parents to kind of like commiserate with other parents. So
some of those library programs, though, are the parents and the kids participate together. I remember, Alex, when our kids were younger too, we had so much fun. Like the library would offer challenges to like build some cool thing out of trash, clean trash, and develop something so that when an egg is dropped from the top of the fire truck's ladder, it doesn't break. Those were obviously very creative and stimulating things for the kids, but they were a whole lot of fun for us too. So I think being engaged, as you said earlier, and involved with your kids too is really helpful. And that seems to be such a challenge these days. So finding ways to do that are great.
Yeah, and we're going to have a bunch of resource links for you in the show notes over at PediaCast.org to a lot of things that we have actually covered in many programs on this podcast. And we're going to kind of bring them back together into the show notes for this episode. And so just as some examples to that, CAP for Kids is it's national and it's also local. So you can there's a whole range of cities that have CAP for Kids sites, and we're fortunate here in Columbus to have one of those. And it's just a site that offers resources of every kind in your community. So if you are wondering where are the local food banks, where can we go to get help with housing or to find a doctor, or any number of the things that we do on a daily basis that you need to know who to contact and who to talk to. And the CAP for Kids, the website, and we'll put a link to it in the show notes, is really fantastic. And I'll put a link to both the Columbus one and then the national one, where it has links then off to the many cities that also have CAP for Kids. Is that something, Alex, that you have used in your clinic practice?
Yeah, we actually sort of narrow it down. It's a huge site. And, when you say, here's the local food banks, and there's a list of like 800 of them, that makes it really difficult. So usually the residents will spend some time to like dig through them and say, here are the ones that are local to us. And that's the one problem with CAP for Kids. And a shout out to your alma mater. There was a student from Ohio Wesleyan who recently made a Google map site. You can plug in zip code, and it gives you a 5-mile radius of all the food banks, WIC, stores that take SNAP, and then also free community meals. And he updates it every couple of months. So I'm not sure if it's shareable yet because it's kind of like in a pilot phase, but our clinic's been using it, and we've been using it with some of the downtown residents. And it's a great resource because it takes everything from CAP for Kids and you just kind of put it down he's a lot smarter when it comes to computers than definitely I am. But he found a way to kind of like put it in there and update it. That was part of his project as a computer science major at Ohio Wesleyan.
Yeah, that is fantastic. Yeah, when that is shareable, maybe we ought to have him on the program to talk about that work and how it's used. So that sounds really interesting. And Alex, tell us again, and I know you've done this in past programs, about the primary care pediatric network at Nationwide Children's. Yeah, because it's a big one.
It's a big one. We're the largest academic primary care clinic system in the country. We have 15 brick and mortar clinics, which has around 250,000, we're probably pushing 260,000 visits this year and about 160 unique patients. We also have 14 school-based clinics, around 200 clinics where we have psychology or social work go. And we also have 2 mobile vans. So it's a big outreach and a lot of like work being done by the whole division. I'm not sure how we keep up with all this. But we're large, and I feel like we're growing all the time. Working in the clinic 6.5 days a week, you're always like, ooh, we're backed up 3 months. And you're like, we're working as fast as we can. We're still always backed up. So it's a good system. And our leadership is really big, like Kai mentioned and Marianne, on social determinants of health and really like working on the community, not just having a clinic system.
Yeah. And we'll put a link to primary care pediatrics at Nationwide Children's in the show notes over at PediaCast.org. So this has been really enlightening and a fascinating conversation. And I once again just appreciate the 3 of you taking time out of your busy schedules to talk about social determinants of health. So once again, Dr. Marianne Abrams and Dr. Alex Rakowsky, both with primary care pediatrics, and Dr. Tyanna Snider, pediatric psychologist at Nationwide Children's. Thank you all so much for spending some time with us.
Thanks, Mike.
Thank you.
Thanks, Mike.
We are back with just enough time to say thanks to all of you for taking time out of your day and making PediaCast a part of it. Really do appreciate that. Also, thank you to our guests this week, Dr. Marianne Abrams, primary care pediatrician at Nationwide Children's Hospital, Dr. Alex Rakowsky, same primary care doc here at Nationwide Children's, and Dr. Tyanna Snider with pediatric psychology at Nationwide Children's Hospital. Don't forget, you can find us wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. Our landing site is PediaCast.org. You'll find our entire archive of past programs there, along with show notes for each of the episodes, our terms of use agreement, and that handy contact page if you would like to suggest a future topic for the show. We're also on social media. We love connecting with you there. You'll find us on Facebook, Twitter, LinkedIn, Instagram, Threads, all of those places. Simply search for PediaCast. And also don't forget about PediaCast CME. It is similar to this program. We do turn up the science a couple notches and offer free continuing medical education credit for those who listen. And that includes physicians, of course, but also nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And since Nationwide Children's is jointly accredited by all of those professional organizations, it's likely we offer the exact credits you need to fulfill your state's continuing medical education requirements. Of course, you want to be sure the content of the episode matches your scope of practice. Shows and details are available at the landing site for that program, PediaCastCME.org. You can also listen wherever podcasts are found. Simply search for PediaCast CME. Thanks again for stopping by, and until next time, this is Dr. Mike saying stay safe, stay healthy, and stay involved with your kids. So long, everybody.
This program is a production of Nationwide Children's. Thanks for listening. We'll see you next time on PediaCast.